Cold immersion studies involve exposing the body or a specific body part to cold temperatures to assess vascular response and function. These studies typically involve measuring changes in blood flow, vascular tone, and other vascular parameters before, during, and after cold exposure. Participants may immerse a limb or their entire body in cold water, or undergo local application of cold packs to induce a controlled decrease in tissue temperature. Cold immersion elicits vasoconstriction, reducing blood flow to the exposed area. This response is part of the body's thermoregulatory mechanisms to conserve heat and maintain core temperature. Cold immersion studies have clinical relevance in various fields, including sports medicine, rehabilitation, and vascular health research, providing insights into vascular function and potential therapeutic interventions for conditions like Raynaud's phenomenon or cold-induced injuries. To prepare, there is an involvement of obtaining informed consent from participants, ensuring they meet inclusion criteria, and providing instructions on the study protocol, including clothing removal and positioning for immersion. Before immersion, baseline assessments are conducted, which may include recording vital signs, measuring baseline blood flow using techniques like Doppler ultrasound or laser Doppler flowmetry, and obtaining subjective assessments of comfort and sensation. Participants are immersed in cold water or have cold packs applied to the targeted area for a specified duration, typically ranging from several minutes to half an hour. Temperature and immersion time are controlled variables. Throughout the immersion period, researchers monitor participants closely, recording physiological responses such as skin temperature, blood flow changes, and subjective sensations like discomfort or pain. After cold exposure, researchers continue to monitor participants for a period to assess recovery and post-cold response. This may involve repeated measurements of blood flow, skin temperature, and subjective feedback to evaluate vascular recovery and any lingering effects of cold exposure. Cold immersion can induce vasoconstriction, reducing blood flow to the exposed area. By measuring changes in blood flow and vascular tone before, during, and after immersion, vascular surgeons can assess vascular reactivity, which is crucial for understanding the health of blood vessels and diagnosing conditions like Raynaud's disease. Cold immersion studies help researchers understand how blood vessels respond to cold exposure, which is valuable for studying conditions like frostbite and other cold-induced injuries. By studying vascular responses in controlled settings, surgeons can develop better treatment strategies for such injuries. Vascular surgeons may use cold immersion studies to evaluate patients with vascular disorders affecting blood flow regulation, such as peripheral artery disease or vasospastic disorders. These studies provide insights into the underlying vascular dysfunction and aid in treatment planning. Cold immersion studies can also be used to monitor the effectiveness of therapeutic interventions aimed at improving vascular function. By assessing changes in vascular responses before and after treatment, surgeons can determine the efficacy of medications, lifestyle modifications, or surgical procedures. In sports medicine, cold immersion studies help assess the effects of cold therapy on vascular function and recovery after exercise-induced muscle damage or injuries. Vascular surgeons working in this field can use these studies to optimize rehabilitation protocols and enhance athletes' performance and recovery. Give us a call today at 480-668-5000.